Excerpts from the Experts, 7-minute learning sessions with researchers and practitioners in the field of eating disorders, and families and individuals who share their experiences and perspectives. I'm your host, Sarah Bowie Keaton. This week, our guest is Paula Edwards-Gayfield. She has over 20 years of experience in the eating disorder field with a special perspective on diversity. She is a licensed professional counselor and a licensed clinical mental health counselor supervisor. Paula, welcome to the program. It's a pleasure to have you.
Yeah, thank you. Something that I'm really passionate about, as a Black woman, person of color, just making sure that I create opportunities to let people know who look like me that they could struggle with an eating disorder, and then how can they access treatment and how can they get the support and services that they need. I think that during the pandemic, there have been a lot of individuals who have increasingly come forward with acknowledging mental health concerns and then seeking treatment. However, historically, and I think still present in the Black community, as well as other communities of color, mental health concerns are still taboo. And there are messages about you keep things in the family, you pray about it, you go to, sort of like your internal circles, but yet not ever really having the opportunity to seek treatment. So often the image is a young adolescent, young adult, white, middle class, higher class, socioeconomic status, and primarily anorexia is sort of the picture I think that comes to individuals' eye when they think about who gets an eating disorder. So as a person of color, as a Black woman, it could be, well, I don't fit that mold. And so believing that they don't have an eating disorder. But eating disorders come in all sizes and shapes. And so my hope and goal is to educate and increase awareness amongst Black individuals that you could struggle with an eating disorder. And then how do you sort of get your needs met? Who are you talking to? If you're talking with your providers, how are you asking for support? I will state that not all providers know about eating disorders, and that's inclusive of doctors. And oftentimes that's where people go to first, but making sure you may know what the questions are, that you want to ask. If you have concerns, utilizing NEDA's websites about, their checklist that could be sort of a questionnaire for them to follow, like if there is a concern, and maybe that's what you're bringing to your providers as well. Resources like NEDA, the National Eating Disorder Association, will definitely be a place to start, as well as just sort of researching eating disorder treatment facilities. That could be a place going to, if they're in school counselors, if they're in college, again, there are college mental health facilities. And I would also say maybe take the risk, sort of sharing with the person that you trust. I don't know what's going on. I know something is not right. And, would you be willing to assist me or support me if I do schedule an appointment, but really opening up to someone that you trust, that is in your life, that's going to be, that historically has not been judgmental and pretty accepting of you. Because eating disorders affect everyone. It is so important for people of color, especially Black people, to be their own advocate. Historically, when we talk about trust in the healthcare system, it's one of those places where individuals may be less likely to seek out because they've often been told, or they know stories of individuals who sort of been told, oh, that's all in your head, or maybe they're not even being asked the questions because, again, they don't fit the stereotype of an eating disorder. There's no commitment in contacting a treatment facility. It's asking the question and having the referral. Whether it's insurances or medical professionals, automatically what kind of kicks in is like BMI or what's your weight. And, a lot of the eating disorders, it's about the behavior, not the weight. But even when I think about BMI, which we try to abolish as much as possible, and we do not discuss those things, outside of having to report it to insurance companies, that is not uncommon for various ethnic groups. Their BMIs, their body types are not that of a white individual, and BMIs are based off of a white male. And so even if you think white female, like their BMI isn't going to be that of a white male. And so that's where that was created. And it does not take into account ethnic differences. It doesn't take into account bone structure and things like that as well. And so when you think about people of color and Black individuals, it's definitely going to be a bit different for them as well. 3 takeaways for that I would want people to know is one, eating disorders affect everyone. It knows no size, shape, or weight, or socioeconomic status, no race, gender, or orientation. Everyone can be impacted by an eating disorder. And it's just getting the information as to what you need. The second thing that I would say is, even to a family member, if you notice that a loved one is struggling, or someone that you care about, or that's in your world, so to speak, say something, gently. I sort of think about gentle nudges, or, what have you noticed? Not sort of questioning or confronting them, but point out what you've noticed, and that you're concerned and you want to be able to support them, and you're here for them whenever they decide to talk with you. And then just also be your own advocate. Please be your own advocate. If you are struggling, do not let any healthcare professional sort of shut you down. Ask for questions, ask for referrals, and keep asking for it. I think the one thing that can happen is, if you're already questioning and struggling, to sort of come forth, and then you sort of obtain this provider bias that confirms you're okay. I think it's so easy for then an individual to walk away and tell themselves that I'm okay because the professional didn't think that they were okay. But all professionals are not treated equal either. They're not getting all the training in eating disorders. And lastly, eating disorders survive in secrecy. Again, going back to the reason that support systems are so important, that then you have that individual as well as a treatment team that you're working with to really assist you in your journey of recovery.
Thank you so much. This was really informative. I appreciated it.
Absolutely. Thank you.
NEDA's mission is to support individuals and families affected by eating disorders and serve as a catalyst for prevention, cures, and access to quality care. NEDA offers programs and services designed to help you find the help and support you need. Whether you have been personally affected by an eating disorder or care about someone who has, recovery is possible, and we're here to support you.